So here's what we're going to talk about today. I'm Nick Design, just a little bit of my background. We'll go to the next slide. A little bit of my background. I am an engineer by education, did my undergrad and master's in electrical engineering, and I'm not saying that for any reason other than the virtue of my education and age. I'm 53 now. I've been around for the creation of most of the life-changing technologies that electronics have brought our way in the last half century, right? Starting with the computer, and then the mobile phone when it was back to the brick days, if those of you that remember, and then the internet, and then the smartphone, and the proliferation of GPS and high bandwidth mobile devices. And along came this thing a few months ago called ChatGPT. And everything was ChatGPT, AI. But AI has been around for decades and will be around for decades. And ChatGPT isn't the only thing in AI, but generative artificial intelligence, which is what AI stands for, is, in my estimation, the most exciting, most fast-moving technology in terms of altering the way we live our day-to-day lives, right? When I was out of grad school in 1992, I worked on the commercial GPS receiver engines at Rockwell Science Center. And I was just telling this to my kids, that back in 1992, the resolution of GPS was about 1 mile. So you could tell where someone was within 1 mile. Now you can tell where something is within a few feet. And that's why we all navigate using GPS, and we don't think about maps and MapQuest and all this kind of stuff anymore, because we can just get anywhere we want, right? But from that 1992 to now, or the last several years, it took 20 years for that to happen, right? From the cell phone to the smartphone to high bandwidth, good battery life devices took about 20 years, right? This revolution is happening in days and hours and minutes. And I have the unique perspective because after doing grad school and doing a couple startups, not in healthcare. 8 years ago, my wife and I started a company called Heal that some of you may remember, have heard of. It was a doctor house call company. It was like Uber to get a doctor to come to your house. We built it. It was quite successful. We sold it to Humana for a 9-figure exit. And then we started this company. And so I've seen healthcare and I've seen technology, but I'm not some GPT salesperson. I have no stock in any of these companies, but I think it's exciting because of its transformational power and the timing of the market and the fact that we're already all using all these other technologies. All of us have in our pocket some version of a smartphone that has gigabytes of data and the gigabits of bandwidth and the ability to call and text and image and do all that stuff. And now we're going to be building on top of that technology with what GPT is and what it can do in the context of healthcare. Right? And that's kind of what we're here to talk about, right? And I think that whenever we talk about new technologies like this, it's important to remember and say up front that no one technology can solve every problem. We'll talk about a little bit about what GPT can't do and what generative AI cannot do, right? And every technology can be misused, right? Every technology has negative implications and negative connotations, and kids are getting too much screen time because of this, and kids are doing this because of that, and now no one's going to do homework because of GPT, right? Or whatever the case may be. So yes, we'll talk about some of the pitfalls, but mostly we'll talk about how to embrace the potential to solve so many of the problems. Because the other thing to remember, and I always think about this when I see ads or news articles saying self-driving car has accident, right? It never says how many regular people would have had an accident at that same intersection driving their own car, which is probably 10 times or 100 times as many, right, as that self-driving car. And that's not to say technology shouldn't strive to be better or perfect, but it's to say that we have to take the context of technology in against what is available now, right? And the state of the art now in healthcare, unfortunately, sucks. Right? I mean, flatly put, it sucks. And there are so many ways in which you could talk. I could do a whole 35 minutes about problems in US healthcare, but you've all heard them and you know them, and that's why you're here, is to hopefully try to make it better, right? $4 trillion spent, declining life expectancy, blah, blah, blah. But one of the most interesting points to mention about how healthcare is suffering is a few interesting points to mention is we're having a population inversion, right? More and more people are living longer and there are plenty of people getting older, but people aren't having children at the same pace. And so there are not going to be enough caregivers and caretakers. And we're not a society that has an institutional, in some Eastern societies, people just live in the same house with their parents and grandparents, and the kids take care of the parents and then become the parents who have kids who take care of them. That's not this society. And so there's going to be an acute shortage of people and technologies to do this. What's another trend that's happening is, on a day-to-day basis, customer service is disappearing, right? The pandemic sort of accelerated this, we don't need to answer the phones. We don't even have a phone number. You call and you get a call center in some other country. And I called Mammoth Mountain the other day to change a reservation that we had to do some spring skiing with the kids. And it was like, your hold time is 8 hours and 43 minutes. I'm not even joking. That was real, right? That's for Mammoth. For healthcare, it's like there isn't even a hold time. Just good luck, right? Oh, you tried to call our phone number? Good luck. Just be dead instead, right? That's where we are. And so against that backdrop, this is me and Renee, and ironically, we didn't take this picture together, so I don't know how they put together. So first of all, what the hell is generative AI? So this is a big number. That's 10 trillion. That's a lot of zeros, okay? Generative AI is taking language, which is words, questions, answers, data points, facts, figures, pictures, videos, anything that can be turned into ones and zeros, 10 trillion of them, 10 trillion endpoints, and feeding it into an engine that transforms those into understanding, much in the same way that our human brain does. Our ability to develop complex thought as human beings is in part dependent on the fact that we develop words. And that's why adults, and as my kids grow, I see my 4-year-old and 5-year-old and 6-year-old, they have more interesting, more complex, more fully formed thoughts than when we're 2 or 3 years old, right? So what this does, and what the chat interface does, is it allows any of us to interact with this and ask questions, and it feels like I'm having a conversation. And a lot of times the answers are correct. And a lot of times they're a little off or a little funky, like you do a Google search for your name, but you find another person with your name that lives in another place and does another thing, sort of like that, right? There's sometimes where it's accurate and sometimes where it's inaccurate, but it feels very easy to talk to because it feels like you're having a human-like conversation, because no one's ever fed 10 trillion data points of anything in anything before. And as soon as you feed it, and as soon as you give it the ability to say every subsequent chat that everyone has should be input from which you learn, and the more recent ability to read the internet so that the computer is as smart as everything on the internet that day, every piece of news, every piece of information, every price on Amazon, as soon as you give a computer the ability to do that, it feels like you're having, hey, what's the best place to buy this? And what's the best price for this? And it's really amazing, right? My wife jokes around with me that before we had kids, she used to have interesting conversations with me. And now that we don't have time for that because 2 of our boys are in Little League, she has interesting conversation with ChatGPT. GPT has replaced me as a husband, you see. It doesn't do the dishes yet, which is an interesting segue to what GPT can't do. Right? The first mistake that people make with this new technology, especially this one, because it feels human-like, is they expect it to be human, right? And to do anything that a human can do. No, it can't do the dishes. And no, it can't make you rich, thin, rich, and young again. No, it cannot, okay? But what does that mean in the context of healthcare, okay? Generative AI is not ready to be your doctor. Okay, and we'll talk about that at the end. It's not ready to help, it's not ready to prescribe medications to you. It's not ready to diagnose whether you just have gas or a heart attack, okay? It's not ready for that. And in fact, the use, in my opinion, of generative AI to give you answers to questions is not its best use, because its answers can be wrong. The use of generative AI to help solve problems or deduce large amounts of information into very small amounts of information, right? Or humanly digestible information, or as an engine to complete tasks, it's incredibly powerful. And that's the difference between an open-ended search and a closed-end search. Hey, GPT, I had burritos last night and now my chest is hurting. Is this a heart attack? Okay, that's an open-ended question. It could be a heart attack, it could be gas, it could be a bad burrito, it could be something completely unrelated, okay? Hey, GPT, here's my 50-page insurance plan. Can you read it and tell me what my health benefit, my dental benefits are? It'll get that second question right 100% of the time because it has an incredible ability to read those 50 pages way faster than any of us could, zero in the words dental benefits and regurgitate them to you, and that's a closed-end search. The answer is contained in the information that you gave it. Or you use it to complete a task, which we're going to get into. Right? How can GPT complete tasks? Now, if you think about this, and let me just go to the next slide, right? The other problem people think with this is, ooh, I'm gonna take the simplest thing and I'm gonna make an app out of it and I'm gonna throw it in the app store and it's gonna work because I put GPT in front of it, right? Just because you make an app doesn't mean people are gonna use it. But people aren't stupid, right? People aren't gonna just use anything. So this rush, what happens, I remember when the iPhone first came along and you should have seen some of the apps that were on the App Store. There was an app literally made by a company that you could press the app, turn on, and then tickle your phone and it would make tickling sounds, right? Someone made that. And I'll bet you some people downloaded, but it didn't have staying power. It wasn't really understanding the context of what this powerful technology could do and how it could be used to help real life, right? Touching your phone screen, you're not really helping anyone's real life, right? And so there's this rush early on, but when the dust settles, when the excitement settles, when some of the early startups go out of business, when some of the apps fail, when people turn the page to whatever the next new things, when the Kardashians do something even crazier, okay, then we'll all move on, and that's when the real innovation will actually start to happen. So here's a great example of what GPT can do. Let's take, how many of you here have health insurance? Probably all of you, right? Okay. How many of you have read your entire insurance benefits plan? Okay, no one, right? But GPT can take this information from that card, that scan, which, by the way, how does it get it? Well, everyone knows how to take a picture with their phone, right? You take a picture of that card, recognize the characters on it, feed it, it can go to the internet, find your plan, read your plan, and come back and answer specific questions, right? So is Ozempic covered? And this is a very popular drug nowadays, right? Ask any primary care doctor, ask any insurance company, they're getting this question more than any other because something that can make you thin, at least apparently, is Ozempic for the people it works for, and if you want to stick yourself once a week, but I'm digressing. Is Ozempic covered under my plan? Well, no, it requires a prior auth. You need to work with your doctor to get it done, right? But think about this in the context of the question, the comment I made about the lack of customer service availability, right? To find out the answer to this question, you can either read your 100-page plan document, which probably doesn't have it because your plan document was probably printed before Ozempic was even a thing, right? And they don't list individual drugs, they list classes of drugs. Or you can ask your doctor and your doctor can say, okay, well, we're gonna work on it with our back office, and a week later you have to keep calling and keep calling and keep calling. Or you can call your insurance company and wait on hold, and wait on hold, and wait on hold. Right? But this interface does not require that kindly old gentleman right there to make a phone call. It does not require them to type anything because when generative AI was developed, a number of companies very quickly developed voice engines to it that are phenomenally accurate across millions and millions of words across 65 different languages. So that person could be someone who speaks Korean or Vietnamese and ask this question using their voice to their phone, and the phone could go back and give them a natural language response from their insurance plan that tells them exactly what to do. And by the way, you could go a step further. This is a simple animation here, but to say this is exactly the form your doctor would need to fill out. And these are the questions you should ask your doctor about if this drug is right for you. Now remember, it's not giving you answers. It's not an open-ended question. It's giving you suggestions. You can't go get the drug on your own. It's not prescribing the drug. It's telling you to go have a conversation with your doctor. It's telling you what form they need. It's making that process dramatically simpler for you, and it's taking away a huge piece of the customer service headache. But let's take it a step further, right? Let's say that this is a conversation right now that, yeah, you have to have with your doctor, and then your doctor says, yeah, you know what, Nick, you are a good candidate for Ozempic. Apparently the pizza eating days of my life have made me a good candidate for this drug. Okay, you are a good candidate, so I gotta fill out the forms, I gotta wait, I gotta call your insurance company. That's all bureaucracy and wait time, right? And that, by the way, the insurance company doesn't love that either, because there's people and adjusters and this and that. So level one of this is, hey, I avoided the phone call and I avoided the hold time because I was able to ask this question in a very comfortable and conversational way, just based on a scan of my insurance plan. And by the way, this doesn't have to be about Ozempic. It could be about my dental benefits or my rideshare benefits or my mental health benefits. And, we come in an industry in healthcare where there are dozens and dozens and dozens of point solutions, of vertical point solutions, right? The mental health app and the heart health app and the diabetes app. But you know what? A lot of people have diabetes and heart health issues, also have mental health issues, and they wish all those apps would be one, right? And insurance companies are wishing that. So if your app could tell you when your doctor says, hey, you should go get your teeth checked, or you need mental health, or a therapist for supporting with this disease state, and the app could come back and say, hey, you know what? This is covered under your plan. Do you want to try this online service? There's no copay. It might make your life a lot easier, right? So level one is replacing the phone call. Level two is going beyond and providing you information that helps answer the next question, from your doctor says you should do to I have done. But level three of this would be when machines are talking to machines on both sides. And this whole process is done. The doctor gets their thing. Yes, the human has to weigh in and say, this person's a good candidate, I'm prescribing the drug. But all the rest of it is done almost instantaneously because there's no person on the other end, right? There's no law written that an insurance company has to be slow, and people who sit there and adjusters in random places in Illinois and Iowa where insurance companies, adjusters all work, right, have to do this. Let's take another example. So this guy gets a card that says he has a doctor's appointment, right? And you know that little card I'm talking about, they all give you, it's like a little postcard, and they handwrite. And he takes a picture of his card. And this actually works. We've actually built this, right? He takes a picture of his card, that little card that's handwritten, and it recognizes that handwritten text, and it recognizes an appointment. And based on where he's standing at the time, it knows who the doctor is. And it knows, and it puts the appointment not just on his schedule, right? On his Google Calendar, on his iPhone calendar, but if he has a caregiver, right? He might be my dad, who's 86, who doesn't drive himself to the doctor anymore. Either I go or I send an Uber, right? And I take him to the doctor, so it puts it on my calendar, so I know, right? But maybe he lives alone and he doesn't have this wonderful son. I'm saying I'm a wonderful son. I don't know what his opinion is, but he doesn't have a son to drive him to the doctor's appointment, and he doesn't quite know how to use the Uber app, and he doesn't know if it's paid for. Well, guess what? A lot of Medicare Advantage plans cover rideshare. So going back to our previous example, now he could take that appointment card, put the appointment, the app could know he doesn't have a ride, it could check his insurance, make sure that the rideshare is covered, have an integration to the rideshare app, order the ride at the appropriate time, put in the addresses, and get the Uber to show up. This works right now today. This isn't hard to do, but it's phenomenally valuable. And it saves a phone call saying, hey, how do I get to the doctor's office? And it saves the call that a lot of older people are forced to make, unfortunately, which is, I can't get to the doctor, I'm just gonna call 911, right? Or I'm gonna skip the doctor's appointment. Or I'm just gonna sit at home in loneliness and suffer, right? None of those things have to happen. And this benefit that's already included in this person's plan is paid for, so the person makes their doctor's appointment. And they make the follow-up, because that little card doesn't just apply to getting to the one doctor the one time. That doesn't where it ends. When you go to that doctor, they're gonna give you a lab slip that says, okay, now you gotta go to the lab and you gotta take an appointment for that. And the lab is gonna send you to the imaging place. And the imaging place is gonna say, okay, now you need to follow up back with the doctor. And the doctor's gonna say, now I want you to see the specialist. Now I want you to go pick up the medications. All those steps can be happening more and with increasing automation and ease. And the system is always learning. So it's getting better and better and better at predicting who you are and what you need and what those follow-up steps are. And let's say you go to the doctor and you get that stress echo and everything's good, and then you have to go back in a year, okay? The system's very good at remembering when a year is and proactively calling your doctor. And the system we built in our app, as an example, we will literally call your doctor's office or the lab or your pharmacy and order the refill for you. Or call your doctor and make the appointment for you and then add it to your calendar. All using IVR, all using automated dialing and a script generated by a generative AI, right? So you're not having to make those phone calls. Let's take another example. This person is taking this medication. How do we know it's taking their medication? They took a picture of the pill bottle, right? Again, something anyone can do. Their son took a picture of their pill bottle, right? I go to my dad's house. He's not feeling well. He's sick. He's like, Dad, son, I need help. Okay, I don't know anything about him. I mean, I know him, but I don't know anything about his doctors, what prescriptions he takes and why he takes them. Most people don't. I could take a picture of his pill bottles and build a full health profile because the pill bottle says what the medication is, who the doctor is that prescribed it. You can easily extract why the person is taking the medication, what complications it might have, when the refill date is, what the dosage is, what the likely interactions are, right? And this person might say, hey, this medication might say this person has high cholesterol and they're 53, and so they're at risk for heart disease. And because they have high cholesterol and they're at risk for heart disease, they should get a stress echo once a year. And it knows based on the doctor, prescribing doctor on that medication, who my cardiologist is. And you can call the cardiologist office once a year, schedule that stress echo, arrange that Uber, make sure it's all covered in my insurance, get me there, have me do the stress echo, take a picture of the follow-up cards, and have do all that stuff too. Right? So you see all this start to build on each other, and it becomes really interesting because where most healthcare falls down is not in the esoteric edge case stuff. Someone needs a lung transplant or a kidney transplant. Those are the cases that make the news, and they're the sensational high-cost items, right? But most of it falls down because people simply don't get to the doctor, don't get their preventive test, run out of pill. How many of you have had this problem? You have a prescription, you run out, you go to the pharmacy, you wait in line, they don't have the refill ordered. Now they say, we're gonna call your doctor. Now it's a Friday afternoon, your doctor doesn't answer, and who has that kind of time in their life? Now let's take this guy. He's also taking that medication, and he speaks Korean. So I think that's Korean. Hey, if anyone's Korean here and that's not Korean characters, forgive me. And he speaks Korean. He says, this medicine's making me nauseated. And he just speaks that to the app. And the app takes that information. Again, remember, closed-end search. We're not gonna come back and say, oh, instead of this medication, take that medication. But we're gonna get that information to his doctor. Says this person's not taking, because otherwise, what's the common thing to do? You just give up, you stop taking the one. Right? But that one might be the difference between life and death. Might be the difference between having cancer or not. And so the doctor says, well, before you take the medication, have a big meal so that you will get less nauseated. And that information comes back, and we've closed the loop, and we've done this in a closed-ended way that enhances the doctor-patient relationship, but made the communication easier across the board. Right? So these are just some of the, now why am I talking about this? Why is all of this important? Because 80 million people in America have 2 or more chronic conditions, okay? And 53 million people in America, adults, but just like the people in this room, are caregivers to those 80 million people. Except there's a huge overlap between those groups. Right? A lot of us ourselves have chronic health issues, and we're managing dads and moms and uncles and aunts and grandparents who also have chronic health issues. Maybe they're sicker, maybe we're sicker, maybe it's a spouse, maybe it's a partner, right? That's a big number, 2 million. That's the shortage in America, known and predicted today, of primary care doctors, nurses, home health workers, caretakers, and caregivers. In the next decade alone. In fact, there are more job openings expected in America for home health work, unskilled help, and caretakers than any other profession in America, including programmers in the country expected the next decade. This is, whatever side of the political fence you're on, you've certainly heard President Biden talk about the caregiver crisis, This is what it is. Who's gonna take care of all these people? 88% of people over the age of 45 do not have the health literacy to assist in their own health care. And by health literacy, I don't mean they're not doctors. I'm not a doctor. Okay, most of us aren't doctors. It means they don't know the questions to ask. They don't know the words to use. When the doctor says you have hyperlipidemia, they're not translating that to cholesterol and translating that to eat less cheese, right? Which is a crisis I'm in right now, having to eat less cheeses. And 92% of all healthcare costs in America are consumed by those 80 million people. 92%. That's where the costs are. Plus $500 billion a year of lost productivity from people like us driving our parents to the doctor's offices and worrying. And most of it, yeah, you can take your dad to a doctor and you can drive him and you can complain on the way about the traffic and maybe you guys get food after and whatever. But you don't know what the hell the doctor's talking about either because you're in that 88%. I know I am, right? So if we use generative AI to replace these symbols, what does this have to do with the data about the example of looking up the Ozempic or switching the person to the food that avoids nausea or filling the medication or scheduling the stress echo? What it has to do is stuff gets done. You know what the secret to good healthcare is? See your doctor, take your pills, get your tests. It's really actually for an overwhelming majority of people and an overwhelming majority of disease. We often talk about the disease in America that can't be treated or this or that, again, the edge cases. But thanks to modern pharmaceuticals and labs and stuff, we have a great deal of control over things like hyperlipidemia and high blood pressure and type 2 diabetes with metformin and drugs like this for most people, right? Not for everybody. I'm not giving a universal statement, but if you could just get people to take their drugs, 1 in 3 people in that 80 million takes all their medications correctly every day. If you can get them to get timely care, 1 in 2 sees their doctors for scheduled visits. They make their correctly scheduled visits. If you can get them to get preventive steps done, the stress echo and the mammogram and the colonoscopy, that number is 22% who get their preventative health exams every year. And if you can close the loop of communication so that the question doesn't linger for 3 months and it doesn't get forgotten, you can have a tremendous impact on the outcomes of healthcare. How tremendous? $1 trillion tremendous. You can cut $1 trillion out of the healthcare system. And some of that money, one way or the other, all that money is coming out of all of our pockets. Whether it's out of our tax dollars, our insurance premiums, our co-pays, our cash pays, it's coming out of our pockets. So it's real money. Now, where will this take us longer term? Year 1, where we are now is about solving the manual problem. The problem that so much of healthcare, we didn't even talk about filling out forms and forms and forms again. I had to do a sleep apnea study the other day. I got an 11-page form. I fuck this shit. Oh, sorry, pardon my French. It's the afternoon. I'm the only thing between you and the pool, so I'm gonna get a little wild here. But year 3 is data-informed care, making sure that all the data of all your healthcare is synthesized correctly and given to your doctor at the point of them making a care decision. So they don't prescribe the drug that's more likely to cause you nausea, they prescribe the drug that's less, not making the decision for the doctor, but informing the doctor, informing you, and synthesizing reams and gigabytes of data into very simple decision support. Year 5 is data-driven care. Now, using that data on an individual or population health basis to make better decisions. Again, not machines making decisions, but machines assisting in decisions at an individual or population basis. So the doctor is now approving the machine decision as opposed to using it as input. And in our opinion, year 10, we're still a decade away, is when machines are going to actually diagnose and take care of you. Right? And that is the potential of this technology. this wonderful, wild creation called generative AI. And I'm Nick Desai. I hope that was useful, and I'm here for questions. Thank you, everybody.
And really, that's always been the Med Advantage. That's been a Med Advantage idea. It's not really been necessarily where MedSup has been. So I take it from your comments that you don't see
to find more information about well, yeah, our app. Shameless plug here. Thanks for asking the question. He's not a plant, I swear. Our app is called Together by Renee. It launches on June 6th. And if anyone's interested in trying it out, it does everything I just showed you today. This was not I'm really trying not to do a shameless plug, but if you come and exchange the little card scanning thing with me, I'll put you on the early invite list, and you could try it out. It's a completely free app. Anyone? Yes.
Is this going to be based on like ChatGPT large language models, or are you guys building your own large language models that are more medical?
Yeah, so we're not building generative AI. We're using GPT's APIs, but a number of other LLMs, large language models, are the AI engines where they make sense to synthesize the apps that do these kinds of functionality. Yes?
Any difference between ChatGPT and Bard at Google?
Look, there's Bard at Google, there's ChatGPT, there's one that Snap just launched that crashed and burned. There's one that Apple and Pi-New, and then the Happy Face one, I can't remember what it's called. There are subtle and important differences between all these, right? I think that it's case dependent, which is to say I can't give you a blanket answer to this one's better or this one's worse. I think it depends on what your use case is, which API you need to use, whether you value speed. For example, the GPT APIs right now are slow because they're getting a lot of traffic, but they're also they have more data points, right? You don't need 10 trillion data points. You could use 100 billion data points, which is still a lot, or 1 trillion data points, but you could increase the speed, right? So it depends on the trade-offs of what you use. Right now, OpenAI and GPT are getting all the buzz, but there's more and more stuff coming out, and that's great because all of that will push the envelope of innovation, which will push the envelope of expectations, and that'll get us to a better place. So yes, HIPAA compliance is an interesting question that actually has nothing to do with AI. It has to do with the functions that you provide. Our app, for example, does not technically need to be HIPAA compliant because we are not providing healthcare in any way. We're not a provider. We are helping you with healthcare tasks. We are voluntarily HIPAA compliant because we don't want you to think your information is going to end up on the internet or end up serving you ads for Ozempic because you asked that question for the rest of your life. It's not. We are voluntarily, but the HIPAA rules apply to you regardless of what technology you're using, right? What we do is we use any technology or any engine in a way that never violates your privacy, and that should be best practice for anyone doing anything in healthcare, regardless of what underlying technology they use. I have time for a couple more questions.
And I think we'll touch upon this when we wrap up today's session as well. But there's been a couple of recent surveys as well that I think point to some of the favorable things that Brett just spoke about in terms of what the future of MedSup looks like.
Yeah. So the thing to do with this, oh my God, there's a new version. There's a GPT-5 is coming. GPT-14 will come. NVIDIA is making this chip. Google launched Bard. The thing to do is to find the right one for your application and not worry about it, right? Every time a new smartphone comes out, my son comes in, Daddy, we should buy the iPhone 15. We should buy it has a 14.2 megapixels instead of 12.2 megapixels. I'm like, do you know the difference when you look at a picture of yourself? Then don't worry about it, right? But use what you need, right? Just because, remember, for those of you that are old enough, you'll remember when the PC days, every year it would be like 40 gigabyte hard drive, 80 gigabyte hard drive, 90 gigabyte hard drive. But the reality is if you had what you need, don't throw away what you have, right? Build on what you need, but what I will say is build with extensible APIs so that you can switch to a better model more quickly. And by the way, AI will help you write those APIs to be more extensible itself, right? We have 4 coders in our entire company. Okay, the rest is prompt engineering that I myself and Renee, the two of us do. Last question? Anybody? All right. Well, look, thank you, everyone. If you wanted to, I can card exchange with you now. If you don't have time for that, I am nick@renee.com, NICK@RENEE.com. It's super easy. Thank you for listening and hope you enjoy the rest of the conference.